The Australian mental health system is complicated and can be hard to navigate. Young people don't always get the care they need the first time they ask for help. The health system often treats everybody in the same way, and it can be hard for a young person to ask for help. It's organised to make a young person feel like they need to fit into a box. It's more one size fits all ages, all types, all problems. It can feel a bit like a jumbled mess. Our Youth Mental Health and Technology team at the Brain and Mind Centre have been working to help young people to have an easier journey through the system. It's called the Brain and Mind Centre Youth Model of Care. Data collected from over 10,000 young people and their families has led to the development of the model. It describes what high-quality, personalised and measurement-based care really means and what it looks like. The creation of our model continues to be a collaborative process with young people and their families. Collecting their experiences was crucial to establishing the key ingredients of what the model is today. The key ingredients are multidimensional assessment, clinical staging, outcome monitoring, and shared decision-making. These ingredients empower young people to take control of their journey through the system. So, what does it all mean? Multidimensional assessment sounds complicated, but what it means is many different things matter and contribute to your mental health, like your relationships, your place in educational work, and your physical health. Comprehensive assessment may involve filling in questionnaires, having blood tests, or doing psychological tests. It takes a skilled team to manage a person's mental health, and one clinician alone may not be able to address all your needs. For example, you may need to see an occupational therapist, a psychiatrist, a social worker, or even a tutor or educational specialist. Clinical staging in mental health is new and not widely practiced. Just like in cancer and other health areas, there are different stages of mental illness. Not everyone is going to be at the same point in their journey, and not everyone will need the same level of care. Diagnosis only gives us a partial picture. It's important to remember that the same diagnosis looks different from person to person and at different points along their journey. For example, one person may have just been diagnosed with depression for the first time, while another may have already managed their depression for much longer. Using diagnosis and clinical staging together gives your care team more information about what level of care is needed for you right now and how best to support you on your way to thrive, not just survive. Outcome monitoring is all about collecting data, which is entirely about you. Data gives you power, and it helps you to get a more detailed picture of where you're at. You can track things like your sleep, activity, mood, symptoms, and behaviour using apps, a journal, or a fitness watch. Whatever your thing is, the more data you have, the more likely you and your health team are to make the best treatment choices. Keeping track of your progress gives you a concrete record of things like your warning signs and triggers, your patterns and trends, and what works and what doesn't work for you. You can adjust your care to match your changing needs and circumstances. You might notice, for example, that your mood changes when the season changes. Being able to see patterns like this means that you and your care team can be proactive and tweak treatment to prepare for the season change. These days we can use all sorts of smart technologies to make this easier to collect and share with your health team. Shared decision-making is just as it sounds. You, your carer, your clinician, and the scientific evidence all contributing equally when deciding on what care is going to be best for you. Everyone has specific expertise to bring to the table. Care should be a partnership, and you should have as much say in the decisions about your care as the people looking after you. Bringing together your goals, preferences, and what you value most with the best available evidence and weighing up the benefits, harms, and uncertainties together with your care team means more appropriate decisions are made. You're more informed and feel empowered to advocate for yourself. If you would like to learn more about the Brain and Mind Centre Youth Model of Care, please visit our website.